All right, it is 1 o'clock, so we're going to go ahead and get started. We want to say thank you for everyone to come and to spend your afternoon with us to learn a little bit about Medicare. Joining our Medicare webinar summer series here. Today, we're going to talk about Advantage Plan Curious. Is your supplement costing you too much? All right. Before we get started, I want to introduce myself. My name is Lee Webb. I've been here at Community Insurance Partners for 2 years. And while I have spent many years in the insurance world in general, just the past 2 years have been focused on Medicare. One thing I've learned about Medicare is that it's not a one size fits all. So the best plan for one person may not be the best plan for another person. So today we're going to talk about some of those options. Our goal here is education. By the end of the presentation, you'll have a better understanding of how Medicare Supplement and Medicare Advantage plans compare. We do have a Q&A section, so if you have questions during the webinar, don't hesitate to click that Q&A option and ask your questions there. And we will, at the end, address all of those questions so that we can clear the air and let you walk away feeling like you have a better understanding of your Medicare options. Let's talk about why this conversation is so important. One of the biggest reasons that people attend presentations like this is because they're noticing that their Medicare supplement premiums continue to rise. Not only does the cost of your Part B rise every year, but you'll see an annual increase on your supplement as well. Many of people that are enrolled in supplements tell us that they haven't reviewed their Medicare coverage in years. Meanwhile, the Medicare Advantage plans have evolved significantly. Many of the Advantage plans now include benefits that weren't available when many beneficiaries first enrolled. Today, we're simply asking one question. Is your current coverage still the best fit for your lifestyle, healthcare needs, and budget? Let's talk about your Medicare coverage paths. So when it comes to Medicare, you primarily have 2 paths to choose from. So your first path is Original Medicare combined with a Medicare Supplement plan and a separate Part D drug plan. Your second path is a Medicare Advantage, sometimes also called a Part C. Neither option is universally better. Each advantage has trade-offs. Whereas like with your Original Medicare and Supplement with the Part D option, you'll see that it says here on the slide that there's broader provider access. Whereas with an Advantage plan, it's kind of like a bundled deal and has those extra benefits that people are interested in. We're going to talk more about both those options as we go through this presentation today. And again, if you have any questions, don't hesitate to put them in the Q&A section so we can address those at the end. All right, so let's talk about what is a Medicare supplement or Medigap plan. While they go by different names, it is the same. It just depends on how it's addressed when you enrolled, and that's probably what you refer to it still as, but they are the same structure there. So we're going to talk about how Medicare, Original Medicare, generally covers 80% of your approved medical expenses. The remaining cost is your responsibility. So if you have Original Medicare and you go to an appointment, Medicare is going to pay 80% of their allowed amount, but you're going to get a bill for the 20%. Medigap plans help cover many of the expenses along the way, but Medigap doesn't include prescription drug coverage, so you'll also need to add a drug plan. Most people years ago didn't understand that that was a requirement. So if you don't add that drug plan, there are penalties involved if you wait until later, even if you don't take medications. So what we want to talk about is how those on a supplement are paying multiple premiums. So they have their Part B, Medigap or supplement, and their Part D. Okay, so 3 supplements to have all your bases covered there, and those extra benefits still aren't covered. So now let's talk about how a Medicare Advantage plan works differently. So instead of combining those multiple plans where you have Original Medicare, then you have your supplement, and then your drug plan, and then if you want to add the dental and vision, Advantage plan puts it all together, bundles it up real nicely for you, and you just have the one ID card. When you go to the doctor, you're just going to go in and show your one ID card to cover your services, whether it's at the doctor, the pharmacy, or the dentist. Many plans include hospital coverage, medical coverage, prescription drug coverage, and those additional benefits. But however, the Medicare Advantage plans typically use provider networks. Years ago, that was what was the drawback to Advantage and made people nervous about them and choose supplements. But times have changed, plans have evolved, the networks have grown. So here on this slide, you'll see a chart here that highlights most of the important differences. You'll notice that the Medicare Supplement plans generally have higher monthly premiums, but fewer costs at the time of service. So meaning that you're paying your premium for the month, but then when you go to the doctor, you don't have any out-of-pocket expenses. But then you'll see that the Medicare Advantage plans have a lower monthly premium, but you may have a copay at your time of service when you go to the doctor. So you don't necessarily have a monthly premium in addition to your Part B. The Part B premium, that doesn't go away no matter which of these options that you choose. But with the supplement, there's no cost when you arrive to your appointment. With an Advantage plan, you may have a copay. Your copay depends on the plan that you choose at that time. Okay, another distinction that we want to point out here is the Advantage plans have an annual maximum out of pocket. Okay, what that means is, again, your Part B premium, it doesn't go away with any of these choices. With your Medicare Supplement, you're paying your medical cost upfront with that monthly premium and then the Part B deductible. With the Advantage plan, you pay your Part B premium, and then every copay for any medical service that you receive while enrolled contributes to that max out of pocket. Once you reach that maximum out of pocket, there's no more out of pocket expenses for your medical care for the remainder of the calendar year. Another reason that Medicare Advantage has become increasingly popular is those additional benefits or ancillary benefits. You'll hear them called those interchangeably. These can include the dental services, your vision exams or eyewear, hearing benefits. Some of them even have over-the-counter allowance or fitness memberships. Some, if you qualify for it, have grocery or utility assistance. It's important to remember that these benefits do vary by carrier and by the county that you live in. So it depends on where you live to see if you qualify for those benefits. Let's talk about some of the common misconceptions that we hear. The first myth is that Medicare Advantage provides less coverage than a Medicare Supplement. In reality, Medicare Advantage plans must provide all Medicare covered services. Another myth that people lose all access to their doctors. While provider networks are important, many local physicians participate in Medicare Advantage plans. And what we do is when you look at an Advantage plan, you're going to look at your doctors, you're going to look at your medications, you're going to make sure those are covered before you make the choice to enroll in that option if you're interested in looking at to see if your benefits will remain the same to be able to keep those services that you're already receiving. Finally, Medicare Advantage is not only for healthy people. We hear that a lot, like, oh, only healthy people choose that. Sick people need supplements and things like that. So every plan includes that annual maximum out of pocket that we talked about. It's to protect you financially. So those are big. And then people think it's too complicated to switch. That we'll talk about in just a moment about enrollment periods and the times that you are eligible to make those changes. So here, this is like a side-by-side of these. We talked about some of these in the past couple of slides. While everyone's situation is unique, certain individuals often find that Medicare Advantage plans are attractive. People looking to reduce their monthly healthcare expenses frequently explore Advantage plans. Others appreciate having prescription drug coverage and ancillary benefits combined into their single plan. And many beneficiaries find comfort in knowing they have a maximum limit on their annual medical spending. Medicare Supplement plans remain an excellent choice for many people. Those who travel extensively or spend time in multiple states often appreciate that nationwide provider access, and others prefer predictable medical expenses and the ability to see any provider who accepts Medicare. For some beneficiaries, that flexibility is worth the higher monthly premiums. This question here is probably the most common that we receive. Which option costs less? Honest It depends on you. Every person's unique. If you come in here with your spouse, you and your spouse may walk out with different options. What we consider are your current premiums, medications, doctor's visits, the specialists that you require to see, how often you have to stay in the hospital, and your overall health care needs. For some individuals, Medicare Advantage can produce a significant savings. For others, Medicare Supplement remains the better value. The only way to know which is the best fit for you is by comparing your specific needs. So a couple slides ago, I mentioned, when can you switch? This is going to discuss our enrollment periods. Most people are familiar with the annual enrollment period that's from October 15th through December the 7th. There's also the Medicare Advantage open enrollment period from January through March for current Medicare Advantage members. So that does not apply to those of you who are enrolled in a supplement. Additionally, certain life events can qualify you for special enrollment periods, like if you've moved from one county to another, if you have a change in your financial status and may qualify for additional benefits, or if you've lost employer coverage. You know, you may be over 65 and still working and you've made the decision to retire. Losing that employer coverage will give you a special election period as well. Before making changes, it's critical that you do your homework. We want to look at your physicians, hospitals, review your prescriptions, and most importantly, we want to compare your total annual cost rather than focusing only on the monthly premiums. A lower premium doesn't always mean lower overall healthcare spending. In our office, we like to call it Medicare math when we look at all of these in one and determine what's going to fit your financial needs best as well. Now, let's talk about this slide. I feel like this is maybe the most important slide in today's presentation of if you switch from a supplement to an Advantage plan, can you go back to it? Many people don't realize that returning to a Medicare supplement plan later may require medical underwriting. Depending on your health and your state, you may not automatically qualify for the same coverage that you have today. Before switching, it's important to understand what options may be available if you ever want to return. As we approach the end of the presentation, we want to encourage you to think about these questions. Are you satisfied with your current cost of your health care? Are you paying for benefits that you're not using? Would additional benefits improve your health care experience? And perhaps most importantly, is your current coverage still aligned with your goals? We're going to recap some of the potential advantages of people find appealing of moving from a supplement to an Advantage plan. The lower monthly premiums, the built-in prescription drug coverage, additional ancillary benefits, that's that dental and vision that we talked about, maybe over the counter, an annual maximum out-of-pocket limit, and simplified plan administration. Again, these benefits are not right for everyone, but they're certainly worth evaluating and thinking through and talking with a professional. We want to thank y'all for coming and spending a little bit of your afternoon with us today. Our goal is not to tell you what to do. Our goal is to help you understand what your options are. If you'd like a personalized review, we'd be happy to compare your current coverage with available Medicare Advantage plans and discuss whether a change makes sense for your situation. The decision's always yours, and we're here as a resource whenever you need us. Your coverage should always work for you. Let's find the right fit together. We've got our phone number here, 251-635-0989. You can find us on social media as well. We're on Facebook and Instagram, or you can visit our website at cipmedicare.com. We've got some upcoming webinars that I'm going to leave listed here for just a moment, and I did see some things come up in the Q&A, so bear with me just a second while I load those questions. All right, so if I want to switch to Advantage, do I just call the plan to change? While the plan can enroll you, our goal today is to bring you in and give you a one-on-one specialized review so that we can look at your doctors, at your medication. If you call the plan, they can only tell you what they have to offer. Here at our office, we work with most of the plans in the area and offer many of the plans that each carrier has to offer. So when we look at it, we do that needs analysis so that we can look at all the meds and all the doctors and compare carrier to carrier along with each of the plans the carriers have to offer for you. If I change to an Advantage plan and it has dental, do I need to keep my dental policy that I already have? Again, we would look at that needs analysis and your dental needs that you have. But with many of the Advantage plans, including dental coverage, we would determine in the moment if it's necessary for you to keep it, but also to see if the dental that you're carrying as what we call a standalone plan currently will work with the Advantage plan that you choose to enroll in. Some of those standalone plans don't do what we call coordination of benefits. So that's something that we would absolutely look into at the time. Just want to make sure there's no more questions. Right. And I do see Madison has shared here in the chat that our future webinars, all that are listed here so that you can click those links. And if you're interested in attending, you can register for those. And again, I'm going to go back to our previous slide just so that you have our contact information. And we hope that we get to talk to each of you soon. We appreciate y'all again spending your afternoon with us. Have a wonderful day.